Hello and welcome to Ask Dr. Dora. I'm Dr. Dora Dixie, board certified in family medicine and addiction medicine. Ask Dr. Dora podcast is my virtual medical ministry that is all about addiction medicine, substance use disorders, and the magnificent bodies we live in, where I always say knowledge is power. The more knowledge we have, the more power we have to make wise decisions. Today, we're going to talk about hallucinogens and club drugs. They are usually found at parties, bars, nightclubs, and concerts, and are used to enhance social intimacy and social stimulation. They are popular because they are cheap and easy to distribute as small pills, powders, or liquids. Most are illegal and can cause serious illness, injury, or even death. GHB is liquid ecstasy. It produces euphoria, increases sex drive, and sociability. You become the horny life of the party, with higher doses causing dizziness, hypersalivation or way too much spit, hypertonia or floppy muscles, and amnesia. You will not remember this party. Overdoses may result in abnormal breathing, seizures, coma, and death because it depresses brain function. Chronic use results in withdrawal syndrome that includes anxiety, insomnia, tremors, and treatment-resistant psychosis that begins a few hours after the last use and can last 6 to 12 days and even sometimes longer. MDMA, ecstasy, one of the most prominent club drugs that acts like a hallucinogen. It is stimulating, but not as stimulating or addicting as amphetamines. Its effects last up to 8 hours. Initially, there is agitation, a distorted sense of time, decreased hunger and thirst, followed by euphoria and a sense of profound insight, intimacy, and well-being. The unpleasant side effects include lockjaw, clenching and grinding of the teeth, a rapid irregular heart rate, dilated pupils, sweating, and urinating. These tremors are much like a Parkinson tremor, where this is pill rolling and the hands are just doing this, and it's uncontrollable. There can be hypertension, irregular heartbeat, the eyes turn inward, you can't pee, there's increased body temperature, and the muscles get tight and have quick jerking movements. The unwanted and unpleasant side effects of withdrawal symptoms can last for weeks. Then there's legal, and I put in quotes, herbal ecstasy that contains ephedra, caffeine, guarana, and some vitamins. It can also be toxic due to intense stimulation of the ephedra and excessive caffeine. Rohypnol, or Roofies, are powerful sedative hypnotics. It's a cheap date rape drug that's sold for 50 cents and up to $5 a piece. It reduces anxiety, inhibition, and muscular tension. It is 10 times as potent as Valium. High doses produce antegrade amnesia, meaning you won't remember this party. There's lack of muscle control and loss of consciousness. The immediate effects last about 30 minutes, but peak at 2 hours. We move on to ketamine, or Special K. It is a dissociative anesthetic that produces a dreamy tranquility and disinhibition in small doses. It's derived from PCP and causes anesthesia without stopping you from breathing. It knocks you out, but you can still breathe. It can cause bizarre ideas and hallucinations. Special K is usually inhaled through the nose and is often taken in trail mixes of amphetamine, cocaine, Viagra, or heroin. The effects appear rapidly and last 30 to 45 minutes with a sensation of floating outside the body visual hallucinations, and a dreamlike state. The downside is confusion, antegrade amnesia, delirium, fast and irregular heartbeat, high blood pressure, slow, shallow breathing, and you just might stop breathing. Flashbacks or visual disturbances can be experienced days or weeks after the last ingestion, and the withdrawal can be severe. LSD and PCP are considered club drugs as well. They are both classified as psychedelics, which alter a person's perception of reality and can cause changes in thoughts and feelings. And both can lead to psychosis that may or may not be reversible. The effects of hallucinogens can vary widely based on the type of substance and the individual taking them. Common effects include hallucinations, that's seeing or hearing things that aren't there, an altered sense of time, feeling like time is speeding up or slowing down, emotional swings, rapid changes in emotion from euphoria to anxiety to paranoia, physical symptoms of an increased heart rate, nausea, and sweating, synthetic cannabinoids called spice mimics the effects of THC or marijuana, but it produces a more intense and prolonged effect than natural THC. The intense reaction can lead to difficulty breathing, psychotic episodes, and violent reactions. Bath salts are stimulants and can cause the same dangerous effects of any other stimulant. Club drugs are categorized as hallucinogens because they affect the ability to think, feel, judge, and act. They make it hard to know what is real, and users can forget periods of time. Everyone reacts differently to club drugs, and symptoms vary depending on the person, the drug, and the dose. The symptoms appear in 10 to 20 minutes after the drug is taken. Everyone reacts differently to club drugs, and symptoms vary depending on the person, the drug, and the dose. The symptoms appear 10 to 20 minutes after the drug is taken. You can go from calm to dizzy with impaired judgment, loss of control, and aggressive behavior. From memory problems to seeing or hearing things that aren't real, from blurry vision to extreme heat or thirst, nausea and vomiting, dehydration and collapse, from drowsiness to agitation, seizures, loss of consciousness, coma, and death, and any other combination of badness you can think of. There is no standard treatment regimen. Call 911, prevent self-harm, and keep them alive. The only club drug with an antidote is the Roofie because it's much like Valium. I hope you learned something today. I promise you, you can have fun without potentially damaging your body or brain. For assistance, call the Drug Abuse Helpline at 1-800-662-HELP. And remember, knowledge is power. And for more, subscribe to Ask Dr. Dora podcast on YouTube so you can watch every power-packed episode. If you have questions, visit my website at AskDrDora.com. Thank you.